first part, you want your patient sitting up, head up. Okay. You'll explain what you're going to be doing. You say you need to put this through their nose. It's going to go down into their stomach. So, and you say it's going to be a little bit uncomfortable, and I'm going to need your help in getting it down. And the sooner, you know, it'll go down, the better, the less irritating it'll be as it's going down. So the beginning part, you want to, first of all, measure about how deep you want to go. So you measure from the nose to the ear to the xiphoid. So you know how deep it's going to go, and you can put a little bit of tape there to remind you. The first part, you want their head to go up. So you want them to look up. So if you go to insert it in, you want to run it along the septum.
Aren't you supposed to measure the tape before you insert it for documentation to see how, like when a nurse comes back to check to see if it's still in place?
I think it's once it's inserted.
Oh, I said mark it.
Okay.
You measured how far you're going to go down, so you mark it there.
Okay.
And then do you
Put tape
document
on
that
it to
distance?
mark it. Yeah, you can. It's not always, it doesn't always have the measurement on it. More often than not, they'll just have the marker on it.
So when the next nurse comes to check the placement, she just looks for the marker?
Mm-hmm.
Okay.
Yeah.
And if it's nowhere to be found, then they just take it out and redo it?
Well, not necessarily. That's why we do check for placement, but
I think you mean measure from here to
Yeah,
here.
once it's inserted, you measure from here to there. The next nurse, if it's too little, then it's because it has traveled.
But if you have the mark,
if you marker, they usually go by the marker. They don't always have tape at the bedside to do that, but
To measure?
that's a good
Okay.
practice.
Oh no,
to
it
do
just
that.
says here.
Yeah. So, but to know how far to put it down initially, you do that measurement and put your marker there. Okay. So you want him to look up initially.
Will they gag?
Yes, they will.
Okay.
What you don't want them to do is cough,
Okay.
because if they cough, then their epiglottis is open.
Oh.
It could be that you've put it down into their trach, and that's what's causing the cough. It just may be that you're right in that area,
Okay.
but you want to, if they're coughing, you want to stop, because you don't want that epiglottis open,
Okay.
because that's where the tube will go then.
And just pull it out and then
You don't have
start
to,
all over again?
no, you don't have to take it all the way out. You
Oh,
just
okay.
back off just a little bit.
Okay.
Wait till it settles down. So when you, I don't know if I can use lubricant on him or not. Who is it in there?
I think she left.
I don't want to mess up the mannequin. But plastic on plastic isn't too good. Does it say not to, or they say not to in other things?